everybody, and welcome to the February edition of the Mary and Pat Show. It is indeed a pleasure to have you all with us on today. We are so thrilled to have you with us, whether you're tuning here live or either you may decide to catch the replay later. Thank you. I am Sharonda Lee, a technology assistant and a certified navigator for the Oak Hill Regional Community Development Center. We thank you for joining us. Now, before we dive in, I know that you are ready to hear from Mary and from Pat, but let's give a great big shout out to this wonderful team behind the scene. Our board secretary, Miss Bettina Campbell, our executive director, Dr. Michael O'Miner, our beautiful project director, Mrs. Lottie Miner. Thank you, thank you, thank you. We could not do this without you. We are streaming live from Zoom, our Facebook pages, our YouTube pages. So yes, if you're on social media, you have to do us a favor. Go ahead and like and share. We want everyone to hear this great beneficial health information. If you have questions, hit us up on Zoom chat or either on Facebook. We'll do our very best to answer your questions during this show. Now, we do have some housekeeping before we kick things off. Now, we have a free app. Yes, I said an absolutely free app that we would love for you to download. It's the Oak Hill Regional CDC app, and it is totally free. Again, it's free. It's not a whole lot that we can get for free, but this app is one of those. It's available in the App Store as well as in the Google Play Store. Just search for Oak Hill Regional CDC or either Mississippi Healthcare Health, and boom, you're all set. Did I mention again, it's free. So please go ahead and download. And once you download it, don't keep it to yourself. Share the app. Go in there, explore, and see what all that's in there. Y'all, it is knowledge, it's power in knowledge. All right, so here's some extra information. Our special enrollment period. You may have missed the regular enrollment period, but you may still qualify for a special enrollment period. This allows you to sign up for coverage outside of the typical enrollment window if you experience a qualifying life event, such as losing your previous coverage, getting married, or having a new child. So just contact us. Medicaid CHIP enrollments, if you qualify for Medicaid or the Children's Health Insurance Program, which we all know as CHIP, you can enroll any time of the year. There's no certain period for Medicaid, for applying for Medicaid or CHIP. Some upcoming events, Let's Talk Real Estate with Area Mays. This will take place on Thursday, February the 27th, 2025, at 11 o'clock a.m. And also we have our third Wednesday parent resource chat, Heart Health. We all know that this is our Heart Health Month. And we also, for our observances, I'm sorry, y'all, that's Wednesday, March 19th at 11 o'clock a.m. And we will provide a Zoom link. February Health Observances, National Black HIV/AIDS Awareness Sunday. That was February the 2nd. American Heart Association American Health Month, Go Red Day. That was on February the 7th. National Black HIV/AIDS Awareness Day. That was also February 7th. And we wore red on February 16th, but it's not too late. The awareness goes on and on. We will remind you again of these announcements at the conclusion of our show. Once again, we encourage our audience to share this evening's webinar. Please share, call your family, your friends, your co-workers, your neighbors, and ask them to chime in. Some great information will be shared on this evening. All right. All right, y'all. It's time for our main attraction. Mary and Pat, you ready?
Yes, we are.
Yes, we are.
Good evening, everyone. My name is Mary Fenner, and I am the application administrator with Oak Hill Regional Community Development Corporation.
Good evening, and I am Pat Boga. I am Medicaid Applications Administrator and Navigator with Oak Hill Regional Community Development Corporation, and we're just excited to be with you this evening.
Okay, so we're going to get started. We have some questions that have been submitted. And Pat, do you want to start with the first question?
Okay, I can. And the first question we have is SSI counted toward income for my children to qualify for Medicaid. I receive a monthly check from SSI, and I already received Medicaid with my SSI, but I want my children to continue to receive Medicaid. Okay, and the answer to that question is SSI does not count toward income on your Medicaid application or your renewal of Medicaid for your children. Now, if there's no other income in the household, they will most likely continue to qualify for Medicaid.
Okay, so our next question is, when do I have to renew my children's Medicaid? Where Medicaid renewals are done annually, you should receive a letter or a packet from Medicaid letting you know that your Medicaid renewal is due. Once they send the letter to you, you need to sign it and send it back, or send back give them any requested information. It depends on, I know they need to verify your income, but they may be able to do it already. If not, then they're going to request check stubs from you. And also, if you need assistance with filing your renewal, we're able to help you at Oak Hill. You can contact us at 662-298-3584 and just ask to speak to an application administrator, or let the person know that you need help with renewing your Medicaid, or even applying for Medicaid for yourself or your children.
Okay, we have another question. I am not working right now, and I have no household income. My parents help me with my living expenses until I can get a job. I also get help from my children's dad. Since their dad helps me, do I still have to cooperate with child support? Okay. No, you do not have to. Well, actually, you do have to cooperate with child support if you want to get approved for Medicaid for yourself. Now, some years back, you didn't have to, as long as you got a statement from the children's dad, the children's father stating he was helping you, but now you do have to cooperate with child support. Your cooperation also has to be documented and verified with child support with CPS that you're cooperating with child support. So just make sure that you get that taken care of, because we do have some that state that they cooperate with child support, but then when they check on it, it comes back as you're not cooperating with child support.
Well, if you apply and you are interested in applying for yourself, then you would have to verify that you are helping, or are um, submit your information to the child support office. So you need to call child support and let them know that that you need to put your children's father on child support so you can be eligible for Medicaid. Okay, our next question is, I am not working right now and I have no household income. My parents help me with my living expenses until I can get a job. I also get help from my children's dad. Since their dad helps
I think
me.
I just did
Okay,
that
so
one.
we must have skipped one. Did we? Okay, you just did that. Okay. My child receives Medicaid, but he is turning 19 in a couple of months. I've been told that he will lose his Medicaid at that time. Where would I go from there? Because my child has asthma and I would still need him. I still need help with purchasing the medication and taking him to the doctor for his regular checkups. Well, if you are employed and once your child loses Medicaid, you can apply for health insurance through the Affordable Care Act because there's been a change in your household. And if you claim him on your taxes, you can apply and use your income as application to apply for your child for the Affordable Care Act. And if you are not, or you're not able to do that, then we'll refer you to one of the federally qualified community health centers where you pay on a sliding fee and you will get help. They will see your child. There's a doctor there that's there that you would see. So it's not like a regular clinic. It's actually a health center. So you could see a doctor, and that would be the doctor you would see on a regular basis. Also, they may be able to assist you, or we have someone here at our office can assist you with trying to get any type of medication that you need on contacting the different medication providers that may have some type of program where you can get help with getting the medication. So just contact us. We can further assist you either with Affordable Care Act application or with referring you to a federally qualified community health center.
Okay. What do I do after Medicaid applications administrator has assisted me with completing my application and it has been submitted to Medicaid? Okay, now one of the main things that you'll have to do is basically just wait on your letter from Medicaid. They will send a letter in the mail, or they may even send an email to you, and sometimes they may even call you. So, but basically, if you are working and you have check stubs from the previous month, you have to make sure that you go ahead and get those in as soon as possible, because if they don't get those within the deadline, then you will probably be denied. But I would advise that you just check on your application and make sure that they've received it in the system, and then just follow protocol and do what, again, just make sure you get your check stubs in and any other documentation.
Right, that's real important because if they don't receive that information, they won't be able to process or approve your application, so you probably will get denied. So now we will have a commercial.
Congratulations! You have successfully selected and enrolled in a Marketplace plan. Choosing the right health plan can be overwhelming, but it is important for you to know that the next steps are just as critical as selecting the actual plan. This is why we created this video, to guide you through on how to get the most out of your health insurance coverage. When open enrollment ends, the period known as From Coverage to Care begins. It is an initiative championed by the Centers for Medicare and Medicaid Services, or CMS, to help consumers with new health care coverage understand their benefits and connect to primary care and the preventative services that are right for them so they can live long and healthy lives. Ask yourself questions like, is there a time when I thought I should go to the doctor but didn't? Was it because of the cost? Was I afraid of finding a problem and how much it would cost if I did? Well, finding out early is better for your health and your pockets. Having health coverage relieves the stress of finding and affording healthcare services when you are sick. It is important to familiarize yourself with common health insurance terms. Terms like premiums, co-payment, deductible, and others. This will help you understand the differences between health coverages. After you understand the terms, it is a good time to learn about the different financial assistance options that are available for you, like premium tax credits and cost-sharing reductions. Once you have a basic understanding of health coverage terms and options, it is important to log into your account with your new health insurer provider so that you are able to pay your monthly premium. In your account, you will also be able to view your policy benefits, activity and usage, your ID cards, and also the ability to participate in telehealth. It's important to know where to go for care. Find a DR before going to the ER. By logging into your account and searching for providers in your network, you will eliminate the hassle of going to an ER. Finding the right provider for you is essential in maintaining good overall health. You may want to visit a few offices to make sure you and your primary care provider are well suited. Be prepared for the visit by bringing ID cards, records of your key information, including medical conditions, dates of past surgeries, current medications, doctors' names and contact information, next of kin and contact information, and any drug allergies. During your visit, it is important to be open with your doctor. Asking questions is key to good communication with your doctor. If you don't ask questions, he or she may assume you already know the answer or that you don't want more information. Don't wait for the doctor to raise a specific question or subject. He or she may not know it's important to you. Be proactive. Ask questions when you don't know the meaning of a word, like aneurysm, hypertension, or infarct, or when instructions aren't clear. For example, does taking medicine with food mean before, during, or after a meal? Now that you have a general idea, it is important to remember to make sure you pay the monthly premium and also continue to make appointments and fill prescriptions. Here at Get Covered Mississippi, we are always ready to assist you. Please give us a call at 662-298-3584 or text us at 662-689-9712. Email us at info@getcoveredms.org or visit our website at www.getcoveredms.org.
Okay, that was an awesome commercial.
Well,
A lot of information. If you didn't catch it all, just give us a call and someone would be able to explain it further to you or send information to you, telling you about the coverage to care. Oh, okay. You're doing the next question, Pat, or myself?
okay. Well, I can take it.
Okay.
Okay. Okay, it says, I was told that Oak Hill Regional Community Development Corporation does taxes free. Is this true? Yes, it is true. Oak Hill Regional Community Development Corporation has a VITA program. And of course, you can come by the facility and bring all of your W-2s, your 1099s, your 1095s, or what have you, and any other documents that are requested. If you don't bring them with you, then you can always bring them back. But sure, just bring them over, or you can call and make an appointment to get them done. And okay, yeah, they do.
Okay. And the next question is that it's similar to the last one. What is the phone number? So I can bring my papers and get my taxes done for free. Well, the phone number, you can call Oak Hill at 662-298-3584. And someone there will be able to give you further information about when to drop your taxes off, when the pickup time is, the location, and the office hours that we're accepting the taxes. So just give us a call, 662-298-3584.
All right, we have another question. What are the covered services Medicaid provide? Okay, Medicaid covers office visits, wellness visits, and care, family planning services for those who qualify, inpatient and outpatient hospitalization and care, prescription drugs, vision and dental visits, eyeglasses, and there are other services. Okay. It even covers psychiatric care and also a transportation. Now for transportation, you will have to call, I believe it's 1-844-525-3085 for United Healthcare. And for Molina, you can call 1-855-391-2355. And I guess, yeah, again, that's for Molina. And you can also check with Medicaid to make sure these numbers are still correct. And for more information on covered services, you can visit www.medicaid.ms.gov. The numbers may be there as well.
Okay. So we have another question. My son was receiving United Healthcare through Medicaid, and then all of a sudden they switched him to Molina. What do I need to do to get it switched back? Because some of the doctors do not take Molina and or regular Medicaid. So what you need to do is call the Medicaid office. The main office in Jackson is 800-421-2408, and tell them that you need to switch back to United Healthcare. But there's a limited time. There's a time limit when you can switch back. So as soon as you find out, and you find out that the doctors do not take it, you need to call right away to see if you can get it switched back. If not, you may have to wait till next year to get it switched. But as soon as you find out and you realize the doctors are not taking it, give them a call at the main office in Jackson, which is 800-241-2408, and they should be able to give you further information about switching those healthcare programs.
Okay. We have another question. I have 2 children, and one of them is on SSI. Will my SSI and my child, would my SSI interfere with the other child getting Medicaid? Okay. No, as we mentioned before, SSI does not count toward household income, but the child will be counted as a member of the household. So you have one that receives no benefits and one that does. But the one that does receive benefits, again, that child will be included in the household number. And that would be the only thing.
Okay. Our next question, I receive child support for my children. Will child support affect my children getting Medicaid? Okay, child support is not counted toward household income as far as Medicaid is concerned. So if you're receiving child support, they will ask you if you are receiving it only to see how or your expenses or how you're living, but how your expenses are being paid, but it will not count towards the household income at all. At one time, they did count child support some years ago, but they changed that, and now the child support is not counted.
Okay.
And we have one more question before we move to our next section.
Okay,
Mhm.
can you go ahead and take that one? I'm receiving a
Okay.
message.
I have just moved to Mississippi and need to apply for Medicaid for my children. We had Medicaid before we moved here. What is the procedure to apply for Medicaid in Mississippi? Well, the first thing you need to do is cancel your Medicaid in the state that you were receiving the Medicaid in. make sure they terminate and make sure you let them know that you have moved and you no longer live there. And then once you started that process, you can put in an application for Medicaid, either by through us at 662-298-3584. We will assist you with submitting a Medicaid application. And also, you will have to submit your proof of income, like we were saying before. And if you're not working, they would need to know how your expenses are being paid. Either you're living with someone or you have a statement from someone that are actually paying your expenses. And that's what you would need in order to apply. But it will not start until your other Medicaid has been terminated, but you can start the process. Let them know that you are in the process of terminating your Medicaid from the other state that you were living in. And they will give you a little time to get that information in stating that your Medicaid has been terminated. So now we will have a presentation from Brother Campbell. Brother Campbell, you ready?
Yes, I am.
Okay.
Good morning, or good afternoon, or good evening, everyone. Assalamu alaikum. I'll throw that in as we're nearing the end of Black History Month. Some organizations, I guess, are not celebrating Black heritage activities, but certainly want you to know that Oak Hill Regional Community Development Corporation is not one of them. All right, so I'm going to talk about a couple of different things tonight. Behind me, you can, my screen background says United Way of Mid-South Free Tax Prep. And so I'm going to talk about how you can access the free tax prep location that's nearest to your physical location. Sister Bolga had mentioned that you could call Oak Hill Regional Community Development Corporation, our number there, 662-298-3584, and get directions to our location. But there are also locations that are throughout the Mid-South, and a little bit later in the presentation, I'll show you how you can get to these particular centers. And something else Sister Bolga mentioned was Form 1095A, a form that's used when you file your income tax under certain situations. So I'm going to talk about how you can access your 1095 if you need it. And then I'll also explain which individual taxpayers might need that particular form. But what I'm going to do first, though, is I want to rerun a program that I ran last year. Okay, so last year we ran this, and this is how to spot a tax scam. This is tax season, and I personally, I'm a VITA. I work with the Volunteer Income Tax Assistant Program. And as we were preparing for this year, there was a lot of conversation about the number of different types of scams that are going on and how important it's going to be to make sure that we maintain the taxpayers' privacy and how we help them guard against identity theft. The different steps that we have to make sure that if we're working with a particular taxpayer, that we correctly verify their identity before we continue with doing their return. And so I'm going to proceed with this program. Okay, at this time of the year, scammers are extremely active around tax season, have a variety of different strategies to try to get your personal information. Never believe phone calls or emails claiming you owe or asking for personal information. If you don't do your own taxes, work with a tax professional who is certified by the IRS or a VITA volunteer. Okay, so you can get ahead of their swindling skills by knowing about their favorite techniques. They like to use phone calls, they use email. You can get hooked up with certain, I'll say, less than scrupulous tax preparers who can get you in an awful lot of trouble. And then there's also the problem of identity theft. With phone calls, I'll read this for you. Although each phone call is slightly different, they all begin in the same way. An unexpected caller who claims to represent the IRS or another government agency. The agency's name may even show up on caller ID. The caller may say you owe taxes, and if you don't pay them, immediately you risk arrest. In a tricky twist on this premise, the caller may tell you your Social Security number has been or will be suspended, and you need to confirm your number to reactivate it. Wrong. Don't ever give them somebody your Social Security number unless you're absolutely certain who they are. And in some cases, you might get a pre-recorded message that demands a callback. Okay, what you should know that the Social Security Administration will never threaten your benefits, and the Internal Revenue Service will never threaten to bring in law enforcement. Never provide any information about yourself over the phone, even if the caller knows the last 4 digits of your Social Security number. Hang up. If you owe taxes, the IRS will mail you a bill and allow you to request a repayment plan. True IRS agents won't ask for credit or debit card information or demand that you pay with gift cards or wire transfer. And they'll always tell you to pay the U.S. Treasury, not someone else. Okay, if you're not sure if you owe taxes, you can find out on the IRS website to see what payment options are available to you. You can also call both the IRS and the Social Security Administration to verify if what you've been told is true. And these are the numbers for the Internal Revenue Service, which is 800-829-1040. And then the Social Security Administration is 800-772-1213. Emails. Another common scam takes the form of an official looking email that supposedly comes from the IRS. Often these phishing emails invite you to click a link for information about your tax return or refund. They may even include a temporary password. The link will appear to lead to irs.gov, but this link will actually send you to a fake website that'll capture your personal information. So be leery of those. Okay, this is a copy of a fake email that you may have received, or that a scammer might send out to you. Let's see. The IRS does not send out emails. So if you get something like this, delete it immediately. If you're able to, you may copy the website or the email address they came from and report that to the IRS as a scamming site. But the main thing to do is don't open it, and then make sure that you delete this. And then this is just another bogus email that you might get, and you can see it might say click on a link to verify your information. If you get an email claiming to be from the IRS, delete it. And certainly if you happen to open it, don't click on any links that may appear, because that could end up giving some scammer access to the memory in your computer, and you could end up getting your computer hacked. So protect yourself from fake emails. I'm not going to go through this. Well, I guess I will go through a little bit. 3 points. Always look at the sender's email to make sure that it comes from an irs.gov address. Number 2, scammers will use the IRS logo to appear more legitimate. And then do not click on any links because it's going to be a scam. Again, the IRS will never contact you by email, text message, or social media. The agency only sends correspondence through the United States Postal Service. Fake IRS emails usually have eye-catching subject lines like IRS important notice or IRS taxpayer notice because they're very effective at getting people to open them. Scammers may spoof the sender's email address to make it look like it came from the IRS, and once open, it may even have the official IRS logo on it. Clicking the link will download malware that infects your computer. From there, it's easy for the scammer to gain access to your financial information. Okay, now something else that we need to talk about. Can everyone see this beautiful check to John Doe, 1234 Whitney Street? Right now, there's a lot of conversation going on about DOGE, Department of Government Efficiency, something that the new administration has implemented. And one of the things that they're talking about is you may get or they're talking about, not may, but almost promising you a $5,000 check from President Trump. And so the question remains, are you actually going to get a $5,000 check from President Trump? Well, the first answer to that is no. Even if President Trump's name is on the check, as it is on this particular sample, the check is not going to come from the president. Yes. Okay, so can the president issue a stimulus check? And the answer is no, the president cannot issue a stimulus check. It's going to have to take an act of Congress. And so there's no legislation that works for this. But I wanted to talk about this because as I was scrolling through IRS information, a little bit popped up about stimulus checks, and there's already websites that are open saying, get your stimulus check early, check on your stimulus check. So should you start seeing information about getting a stimulus check early, don't click on anything. Don't give anybody information about that. Okay, so it's enough about a possible stimulus check. Next thing is the tax preparation caveat emptor. Caveat emptor, let the buyer beware. Around Memphis and around South Haven, Mississippi, tax time last year, happened to see this particular sign that was posted in a lot of different locations, and they're also going up this year. This one is saying $590 or $59.95 tax refund and call a particular number. So just be aware that when you go to a tax preparer, if you do have a tax refund coming, make sure that it's something that's been derived legitimately for you. Don't fall for any scams where the tax preparer wants you to allow them to enter false information, false dependents, or anything to increase a potential refund that you might get for earned income credit or some other tax credit that's out there. Okay, how can you get your taxes done? One method I talked about already, I'll go back to in a minute, is the free tax prep service. But if you don't want to use a free tax prep service as offered through the United Way, Mid-South United Way, other sites that you can go to, one is My Free Taxes. This is a self-filing tax site. And then there's a link for it, http://myfreetaxes.com. And then there's also IRS Direct File. which allows taxpayers to file taxes online directly with the IRS for free. And if you go to the IRS.gov website itself, then it'll also take you to links that are sanctioned, vetted by the IRS that can allow you to file your own taxes with them. Okay, so the free tax service that's available, as Staboga said, yes, we do have it available at the Hill Hernando, 1775 Memphis Street in Hernando. Excuse me. But if you don't live near Hernando and you want to find one that's close to you, you can simply dial 211, and that'll direct you to the VITA site or free tax site that will allow you to locate the free tax site that's closest to you. Again, so 211, I haven't actually dialed it myself, but certainly all you'll have to do is enter something like your zip code, and then it should give you information about the tax sites that are relatively close to you. Now, Staboga also mentioned, as I said, Form 1095A. What is Form 1095A? Okay. If anybody in your household had a marketplace plan, an ACA, a health insurance plan, let's say in Mississippi might have been something that is through Ambetter or Molina, Cigna. There are also a few with United Healthcare. But if you have a marketplace plan, that means that you're going to get Form 1095A, and 1095A is going to have to be filed with your taxes. Don't file your taxes until you have an accurate 1095A. Excuse me. This is something that should have been mailed to you from your insurance provider, but if for some reason you don't have it and you want to file your taxes, there's ways that you can get it. All right, the easiest way to get it is to log into your marketplace account, and then under your application, select your 2024 application. This one says selects tax forms, download all 1095As. If you have any problems, you can call a marketplace navigator. You can contact one at Oak Hill Regional Community Development Corporation at our number 662-298-3584, or you can also call the Marketplace Help Desk at this number, 800-318-2596. If you do have access to your marketplace account and want to download it yourself, I'll show you kind of what it'll look like if this opens. Okay. So how to find your 1095A online. So the first step would be to log into your marketplace account. And then step 2, you're going to select your 2024 application. And this is telling you to select tax forms. Over on the left-hand side, you'll be able to select your tax form here. You'll just click on that particular link, and then you'll get a page that looks like this where you'll be able to download your 1095As. Okay. And so we talked about possibility of protecting yourself from tax scams or other scams that might be out this particular time of the year. The importance of having a correct 1095A and how to download the 1095A, then also availability of free tax filing service at different locations around the state, a bit south. Are there any questions right now?
There is a question in the Q&A. Can you click on it?
Yes, let's,
Mhm.
okay. Are all forms included with the tax preparation, such as long forms that include itemization? The answer to that is yes. We do a short form, we'll also do a long form. And pretty much what VITA volunteers will not do is, as you talk about different forms, we don't get involved into complicated Schedule Cs for people that might have home businesses and they need to just accrue their, just itemize their expenses and deductions and things like that. Generally, if we have one of those, we'll refer them to a paid preparer, not one of our choosing, but just that they would have to take their return there. And then also, along with that question, the household income limit for VITAs is $67,000. So if your household income that you're going to file the return for is greater than $60,000, that means the income listed on W-2s, 1099s, Form NECs, if that's greater than $67,000, then we'll also refer you outside of our location. It's considered out of scope for our services. Okay, so I don't see any more questions in the Q&A here.
One just came
Any-
in chat. Does the tax preparation include self-employed?
Pardon me?
Does the tax preparation include self-employed?
Yes, the tax preparation includes self-employed. Other than, as I said, self-employed, where you have a pretty complicated business that you're operating out of your home. Okay. Okay, said. Thank you. Okay, chat. All right, are there any other questions that may have popped up someplace? All right, well, in that case, that'll conclude my presentation for this evening. Thank you very much for your time.
Thank you, Mr. Campbell. We appreciate that information
You're welcome.
that you have given us. We really appreciate it. You always have good information for us whenever you're on. And if anyone needs any additional information about VITA, or you can always call 662-298-3584, and someone there will be able to give you additional information like he was saying, or you can do 211 to find a place in your area. But if you need the address to our place, you can give us a call and we'll help you in that way. And we're finished for tonight, and we'd like to thank everyone for your questions, for coming on. If you have any additional questions that you need to ask, you can always contact us at the office, 662-298-3584. Give us a call, and we'll be able to assist you further.
All right. Great show, ladies. Great show. Some really great information was shared tonight. And we do again want to thank Mary, thank Pat, and also Mr. Clarence. We really do appreciate you all sharing that information. And again, if you have any burning Medicaid questions, don't wait until March 31st when Mary and Pat's show comes on again. Give us a call, reach out, 662-298-3584, or either send us a text at 662-689-9712. Again, we do want to remind you about our Let's Talk Real Estate on this Thursday, February 19th at 11 o'clock a.m. And also our next third Wednesday Parent Resource Chat will be on March 19th, 2025 at 11 o'clock a.m. Always remember that you can learn more about us at www.oakillregionalcdc.com and also www.healthykidsmississippi.org. And again, you can contact us at 662-298-3584. I know that you've heard that phone number several times tonight, but we want to make sure that it's accessible to you because we are here and ready to assist. As we get ready to end our show again, we want to thank our team for making this possible. Our board secretary, Ms. Bettina Campbell, our executive director, Dr. Michael O. Minor, and also our project director, Mrs. Lottie Minor. This has been a proud production of Oak Hill Regional Community Development Corporation, where we are dedicated to belonging, building, and bridging in the Mid-South region. Thank you all. Thank you for joining us. Good night and enjoy the rest of your